So I'm going to be talking mostly about movement as a part of your migraine treatment plan. And the reason that we describe it as movement is because I'm going to be talking about a few different types of movement. So I'm going to start off with aerobic exercise, whatever that might look like to you. And then we'll move on to strength and mainly focusing on posture. And then we're going to move on to a little bit of yoga and meditation. And in all of those areas, I want you to leave with something that you can use tomorrow to kind of start a treatment plan for yourself. So what's in the realm of movement for you? So it could look like walking, stretching could be movement, dancing, spinning, running, and even yoga. It could be things outside of this, but these are just ones that come to mind. So if this is not something that's in your idea of what you do right now, know that you're not alone. Actually, most Americans live a very sedentary lifestyle, and I am to blame for this as well. I think we all kind of get in this habit that, you know, we spend 21 hours of our day doing sedentary things because that's just the way it is. So sleeping, sitting at work, watching TV, some of our leisure time, spending time on the computer at home, especially now with everything being shut down, and eating. These are a lot of things that we do just sitting. So really the average American spends only 3 hours of their 24 hours a day being active or standing. So that's a really big deal. So this sort of infographic on the right-hand side talks about a few different strategies that you can use to move your body that aren't necessarily what we would think of as exercising, like running or walking. But in addition to that, it could be vacuuming. It could be going to the grocery store. So counting that as your active time during the day. And the point of this slide is not really to go into the specifics of all of these things, but just to help us realize that participating or not participating in physical activity can have a significant positive or negative impact on various different areas of our bodies. So that includes mitochondria, skeletal muscle, cardiac muscle, and even in our vascular system. So we know that migraine is a vascular thing going on, right? So having an impact on that system can have a significant impact in general for you. So we talked a little bit about why physical activity matters in general. Why does it matter for somebody that has migraine? Well, there's a correlation between low physical activity and migraine frequency shown in these two studies. It might influence your brain, so it can decrease stress reactivity, improve your sense of well-being, and change your sense of pain perception. And then lastly, in the study in 2019, there was a reduction in migraine pain intensity, migraine days, and a shorter duration of attack with people that were participating in some form of physical activity. So basically what I'm saying is, if you are not participating in physical activity, that can lead to increased migraine frequency. And if you are, that can lead to a happier brain overall, not just decreasing frequency and intensity, but also influencing your overall experience. So you guys can all kind of reflect on this for yourselves, but what the research shows is that anxiety and fear surrounding migraine is one of the barriers to actually participating in physical activity, even though we know that it can have a positive impact. So 22 to 38% have subjectively reported at least one migraine triggered by exercise in their lifetime. And unfortunately, some of those people left that type of exercise completely as a result. Interestingly, on a side note, a lot of the prospective studies, so this is kind of, you can think of it as retrospective, so people were just reporting on their physical activity and whether they had migraine or not with that. But in prospective studies where people were actually participating in the physical or aerobic activity, there wasn't a significant trigger of migraine with the aerobic activity that they were performing in those studies. So what the American College of Sports Medicine recommends for exercise for just the average adult is 3 parts. So it's aerobic exercise, strengthening, and stretching. And it's 150 minutes of moderate intensity exercise per week. And I'll talk a little bit more about what moderate intensity exercise looks like. Or 75 minutes of vigorous intensity exercise per week. And then 2 days per week of strengthening and 2 to 3 days per week of stretching. So for somebody that is dealing with migraine, what does that look like? Well, it's actually pretty similar as a goal, right? But what I would recommend is really focusing on your initial goal on the moderate intensity exercise, just because I think that's a little bit safer, and that is what a lot of the research uses as their goal. So we're really focusing on that. And the strengthening, you're focusing on neck strengthening and posture strengthening for the most part, specific to your migraine. Obviously, other types of strengthening is also really important, but not part of your migraine plan, probably. I add this picture because it's not going to look like that. That's just kind of a really intense type of exercise for your neck. I'll go over some more specific strengthening exercises later, but that's just so intense. And then stretching is going to focus on your posture and your neck as well. So what are some kind of things that are important to think about? One of them is your warm-up and your cool-down. So we know that this is a vascular event with migraine, right? So we want to really focus on the warm-up and the cool-down. So the warm-up is important because you're working on just getting your muscles used to the environment where they're going to exercise, right? So you don't want to strain anything or cause any adverse events while you're exercising. But then in addition to that, it's kind of priming your vascular system for the higher intensity exercise that you might be performing in the bulk of your workout. For the average adult, like we said, it's 150 minutes per week of moderate intensity exercise. That's what's recommended. But what the American College of Sports Medicine also states is that this can be performed in 10-minute intervals. So you don't have to be performing an hour of exercise per day. It can be 10-minute intervals, and that can be your goal. It can be your end state. It doesn't need to be really long intervals of exercise. Of note, in the studies of aerobic exercise in people with migraine, they use 30 minutes of moderate intensity exercise 3 times per week. And those are the studies that show an decreased frequency and decreased intensity of migraine attacks. So just for your reference. And then, like I said before, we're focusing more on moderate intensity versus vigorous intensity exercise as your initial goal. Obviously, if you get to that goal and you want to push yourself harder and you feel like your body can do it, do it. But if you're someone who's afraid, this is a good initial goal. And then submaximal intensity or moderate intensity is 50 to 85% of your heart rate max. So you want to kind of keep that in mind while you're exercising. And we're going to go over a specific example so that you can all know and leave here knowing what your heart rate maximum is and knowing what your ideal range could be. So a heart rate maximum calculation is 220 minus your age. Obviously, that's going to vary a little bit from individual to individual based on a lot of different things, some of them being just your genetics and what your resting heart rate is naturally, but others being sort of your stress level and things like whether you're participating in exercise regularly right now. People that tend to engage in regular aerobic exercise tend to have a lower resting heart rate. So just for your reference, don't get too stuck on the numbers, but this gives you a range. So we're going to go through this example. So this is my age, 33 years old. I'm out with it. So 220 minus 33 is 187 beats per minute. So that's my maximum heart rate. So if I'm trying to get to 50 to 85% of my maximum heart rate in the bulk of my exercise, I want to remain between 93 to 159 beats per minute. So if my goal was to get to 10 minutes of that intensity exercise per day, if my heart rate is above 93 beats per minute for that entire 10 minutes, then I've reached my goal. So I want you all to kind of calculate that for yourselves. And if you've never assessed your own heart rate, we're going to do that right now. So you're going to use your pointer finger and your third finger, right? So your 2 digits here. And you can look at your heart rate 2 different ways. These are the most common ways that I look at it for myself. You can either use your carotid artery, which is on your neck, or you can use your radial artery, which is on your wrist. So we'll go over how to do it on your carotid artery first. So you take these 2 fingers, kind of feel for where your trachea is, and then imagine where your Adam's apple would be, right? And then you come right off to the side and you should feel a beating sensation. That's your pulse. And you're just going to test how many times you feel that beat within a certain amount of time. If you're going to look at your radial pulse, I want you to just kind of face your palm up. And then again, you're taking those 2 fingers and you're going to place them on the thumb side of your wrist. And you're doing it just lightly. And you should, again, feel a pulse there. That would be good if you felt that. And now we're going to actually test your heart rate. So I'm going to start the timer, and I want you to just count how many times you feel that beat in this amount of time. And we're going to do a timer for 30 seconds. And we're going to start right now. I'm going to stop now. Okay, so whatever your number was, you're going to multiply that by 2, and that's your resting heart rate. So just so you know where your starting point is. So when you're exercising, your heart rate should be higher than that at least, right? Which it will be, even if you're just standing up versus sitting down. So let's say that some of you are like, well, I'm on medications that control my heart rate, or I have a pacemaker, or whatever it may be that is impacting your heart rate. If you don't want to use your heart rate to guess what your physical exertion is, you can use this, which is called the rating of perceived exertion. It's the Borg rating of perceived exertion scale. And it's a scale that goes from 6 to 20. And it basically is just using your own inner guidance to tell how hard you're working. So moderate intensity would be 11 to 16 on this scale. Most of the time, this scale doesn't show this whole like breathing scale part of it and distance scale part of it, but I added that here because I think it's just kind of useful as a cue of how hard you're working. So light intensity, 11, would be you can work out at this intensity and you can still talk in full sentences. And then it goes to the scale of 16, so that's like breathing hard, but you're still thinking clearly. When you're at maximal exertion, which you don't ever need to get to, you can't even think clearly, right? You're working that hard. So this is a good clue into how hard you're working if you don't want to use your heart rate. So to kind of close this section of the talk, I want to just give you guys some cues of how to start a program for if you're not used to exercising or if you're afraid to start exercising. So I would say start small, short distances. You don't have to go far. Let's say that you're doing a walking program. You can start with doing 5 minutes per day. And if 5 minutes per day is aggravating your symptoms, then start with even less. It does not matter where you start. All that matters is that you do start. So if, even a form of exercise could be sitting in your chair and marching your knees up and down. That's a form of exercise. So start with something. I recommend progressing in some way every 1 to 2 weeks. I usually recommend every 1 week. So let's say that you start with 5 minutes of exercise per day. I would recommend that at that 1 week point, you increase by at least a minute. If you feel like you're doing really good and you feel like it's easy, maybe add 5 minutes. So now next week you're doing 10 minutes every day. But if at that week point you're like, I don't know if I can push myself any harder, then add on 20 seconds, something small, but make sure that you make some sort of small change that shows you that you're going a little bit further. And 20 seconds over the course, adding on 20 seconds over the course of, let's say, 20 weeks, imagine where you'll be after that, right? And what I would also say is progress your duration first. You don't need to get to moderate, and even though your goal is to get to moderate intensity exercise, you don't need to get there initially. So if you are, let's say, at a scale of 7 or 8, that's fine. Just be there and keep working at that intensity until you can increase to your end goal of duration. And then once you get there and you're comfortable with that duration, that's when you can start to increase your intensity. So it's just one thing at a time. Don't try to change everything all at the same time. And then frequency, how often you do this depends on your symptoms. A lot of times I tell people, you're going to respond to things differently. So if you do your 5 minutes of exercise and the rest of the day is terrible, you know that that was too much for you. So the next day, do something different, do less, right? Do less intensity or do less duration. And until you find that kind of sweet spot that you're gonna start at, don't progress yourself. First, find your sweet spot where you know that you're not aggravating your symptoms, and then start to work yourself up stepwise. And then lastly, don't forget the warm up and the cool down. That's really important. I know a lot of us are guilty of not doing a warm up and a cool down, but it is important. So we're gonna move on to posture. Sorry, my dog's barking in the background. I think he'll stop in a few seconds. But so with a lot of us working from home and really not being able to go out into the community, our posture is really, really important when we're sitting at the computer, when we're watching TV, when we are on our cell phones all day long. So how many of you, I hope that none of you look like this picture on the left, but some of us are close to it, right? And that can cause a significant impact on our neck and musculature around our neck. I see some of you holding on to your neck, so we're gonna go into a little bit of exercise as well related to that to hopefully make a difference in that. So my main point regarding posture is that neck strengthening and stretching is important, but posture is what you do the other 23 hours of the day. So if you don't work on your posture, it really almost doesn't matter what exercises you do. So posture first. So why does it matter? So 80% of people with migraine had local tenderness in their neck, and 50% of those had headache-like symptoms with palpation of these areas in their neck. So we know that the neck is related somehow. There's a high prevalence of musculoskeletal dysfunction in people with migraine. And one study even showed that people with migraine tended to have a straightening of their natural neck curvature. So that's interesting, and we'll go into some pictures about that later as well. So these pictures just kind of demonstrate different muscles in the body and or in the neck, and how they can refer symptoms to different areas of your head. So this picture on the left-hand side, this muscle is called your sternocleidomastoid. It's just a large ropey muscle on the side of your neck. It starts just behind your ear and it goes just to the inside of your collarbone. And if you have symptoms or pain or anything in this muscle, it can refer symptoms to all of these areas of your head. So just think about how your migraines, what they feel like, and if this might be relevant to you. These are the muscles in this picture in the middle. It's the suboccipital muscles that are affected, and those are really big posture muscles. So if you're constantly sitting with your head forward, those muscles get really shortened, and that can cause problems and pain. And so that can refer to this portion of your head. And then with the upper trapezius, with the upper trapezius here, those muscles being irritated can cause some pain all around your head over here. So just something to think about. That one can even cause some pain in your jaw. So the amount of stress on your neck muscles changes based on your posture. So our body was created to hold a 12-pound head. But you can see that as your head moves further and further forward, that puts more and more stress on your neck and back muscles simply because of gravity and the levers, right? So our bodies were not created for this. Our postural muscles were created to hold up our posture and our head for the entire day. But once we start changing our posture, it puts a lot more stress than is expected. And so if your muscles aren't prepped and strong enough for that, then it's not a good deal. And this is just a picture of the normal cervical curvature on the left-hand side. So you can see that there's a normal sort of, it's mild, but it's just a small curve of the neck, and that's normal. We expect that curvature in the spine. And the abnormal curvature is really lack of curvature, right? This is pretty much straight up and down, this picture on the right. And that can be related to a lot of things. When I look at that initially, I think of somebody looking down at their cell phone, right? And the getting rid of the curvature of the spine with that. And then what I also think about is tightness in the neck muscles and the impact that that might have on the natural cervical curvature. So this topic is important because a lot of times when I think of people trying to improve their posture that might not know as much, I see them pulling their shoulder blades together, bringing their head up. But when you're thinking about your posture, I would recommend thinking of what you're sitting on or standing on first. So when you're sitting, I want everybody to just kind of put their hands on their hips. And close your eyes for a second and just feel your sit bones on the surface that you're sitting on. So you should feel one sit bone under your right butt cheek and one sit bone under your left butt cheek, right? Just notice if you're sitting more towards the front of them or if you're sitting more towards the back of them. So if you notice a rounding in your lower back, I would say that you're probably rounding your shoulders as well, and your neck and head are probably forward as well. Let's say that you round your pelvis forward now. So it's almost like you're sticking your belly out, you're sticking your bottom out, and you're sitting towards the front of your sit bones. Now what happens naturally with your shoulders and your head, right? You don't really have to work hard to bring your shoulder blades together because they're just naturally in that position based on what you're doing with your pelvis. So sitting at work, sitting anywhere, sitting in the car, your pelvis position is really important, and it's really what you need to think of first when you're thinking about your posture. So while I mentioned that shoulder blade stability is still really important, so we want to practice this because a lot of people tend to get it off. So when you're squeezing your shoulder blades together, we're thinking about strengthening the muscles between your shoulder blades, because when you're rounded a lot, those muscles tend to lengthen and then they can't really contract as well as they used to, and they get weaker. So when you're sitting up tall, now squeeze your shoulder blades together so you can start to strengthen those muscles. But notice what you're doing with your shoulders. Are they coming up or are they coming down? So think about your shoulder blades coming down and together instead of straight together or up and together. We really don't want them to come up and together. We want them to either come straight together or down and together. So that I give a lot of times is take one of their hands and put it on their upper trapezius, so that muscle in between your head and your shoulder, and just put it there. That muscle should be relaxed, and it should stay relaxed when you squeeze your shoulder blades together. If you squeeze your shoulder blades up, you're going to feel that muscle tense, and that's what you don't want, right? So you want to strengthen the muscles between your shoulder blades and between the lower part of your shoulder blades. And then lastly, with this with posture, your neck will kind of naturally get into position when you change your pelvis, change your shoulder blades. But this is important to keep in mind as well. Trying not to keep your head forward because, like I said before, that kind of, it really tightens those muscles in the back of your neck and can cause a negative impact. So bringing your chin back is always a good thing to do. You don't have to have a double chin like this lady does on the right, but to some, mild extent of that. And then because a lot of us are at home right now working on our computers a lot, I thought that this picture was important to incorporate. So you can see that this guy sitting at his computer, he has a really good workstation set up, and he has about 90-degree angle in his hips, right? He also has a 90-degree angle in his knees, and his elbows are resting on these armrests right next to him. Another thing to take note of is that he's sitting with his bottom all the way back in his seat. So that allows him to be in a position where his back is resting against the backrest. So he's actually using the backrest, right? And then he's not shrugging his shoulders because his armrests are at the right height. And then for him to be able to get these angles in his hips and his knees, he had to put a little step stool down here. And so that's fine. Whatever you can do to kind of set up your workstation so that you have a 90-degree angle at your knees, 90-degree angle at your hips, and so that your hips are scooted back all the way back in your seat so you can actually use the support that you have in your chair. You can also see that he has a little bit of wrist support over here. So he has his elbows at about a 90-degree angle as well, and his monitor is at about eye height, and it is about an arm length away from his eyes. And if you can't see your screen at that level, that's kind of another thing that you want to work on. So you might need to get closer to the screen, or you might maybe need to go to the eye doctor. And then lastly, this small portion on your strength of your neck. I like to work on neck strength in a supine or laying down position initially, because I think that we use a lot of our superficial muscles and muscles that we shouldn't necessarily be using for this exercise if you do it sitting or standing at first. So I recommend doing it laying down. What you want to do is lay down, put this little towel under your neck to support that natural curvature of your neck. And then just do a mild little chin tuck. And what you're doing with this exercise is you're starting to activate the very small stabilizer muscles of your neck. So you're not really trying to get these big muscles to work. It's not a big movement. It's literally just a head nod. So if you look at me from the side, it looks like this, so I might be like this, and then I'm just doing a little nod. So I'm not really doing anything with my lower neck or my shoulders. I'm literally just moving the top of my head. So we're going to move on to yoga and meditation. And this is kind of it's not my favorite piece, but it is a good piece. So I put this picture of this lady in the middle on purpose, because a lot of times when people think about yoga, that's what they think of. They think of these people standing upside down on their heads and doing weird stuff as if that's yoga. And it is yoga, but it's not the majority of yoga, and it's not the only form of yoga. So if you can do that, go for it. It's great. But that is not yoga, and it's really not the point. So I always laugh because I hear, this is not just in the migraine population, this is in anybody. So I hear people say a lot of times that, well, I can't do yoga because I'm not flexible. Well, that's kind of the point of doing yoga, right? To get more flexible. And then I hear people saying, well, I can't meditate because I can't turn my mind off. I just can't do it. Well, that's also kind of the point of meditating. So when I hear those excuses, I'm like, you really got to do it, right? Because that's kind of, it sounds like you're saying the things that this can help you with. So why do yoga and meditation matter? Well, yoga has a positive impact on headache frequency, intensity, and disability. Meditation and mindfulness can help address rumination and pain catastrophizing. And mindfulness may promote nervous system recovery from a stressful event. So working on these strategies could help you in the long term. And they're not going to be easy at first, not at all. So the definition of yoga is really the union. It's union, it's yoking. And what we're generally thinking of is a union of the body and the mind. And yoga really initially was created because people were trying to meditate, and back in the day people were meditating for hours and hours, right? We don't really have time in our lifestyle to do that, but they couldn't sit there for that long. It was hard to sit there for that long, so it was used to body, stretch their body, and strengthen their body in preparation for sitting. So yoga and meditation are really tied hand in hand. They help one another. So there are many different types of yoga. So you can start where you want and try different classes, because they can be very useful for different times of the day based on how you're feeling. So yin yoga is really focused on stretching your muscles. In the original philosophy of yin yoga, they talk about stretching your ligaments as well. As a physical therapist, I don't know if that's necessarily helpful or useful, and I actually think that yin yoga is still useful, even though that's one of the reported benefits. Restorative yoga, which is what the picture on the left is here. And this might not only be in restorative yoga, you might see it in a bunch of different classes, usually towards the end of the class, but it's using a lot of props and things like that to just get your body in a comfortable position. So both in yin yoga and restorative yoga, you're holding those poses for maybe 5 to 10 minutes. And so you might go to an hour-long class and only do 5 poses. So something to think about. Vinyasa yoga is kind of totally the opposite. So you might be doing a lot of poses in that class, because the goal of Vinyasa yoga is to be almost constantly moving. You're flowing from position to position, and you're using your breath to guide that movement. Bikram yoga, many of you have maybe heard of. It's a pretty popular form of yoga right now. It's in a heated room. So you would probably want to work your way up to that. It's a pretty intense form of yoga. And if you wanted to do it, go for it. It's something to try. A lot of the research related to yoga hasn't been done on Bikram yoga, though. I'll just give you that sort of side note. Kundalini yoga is an older form of yoga that's really focused on ailments. So, for example, you might get a Kundalini yoga set that's good for anxiety, or you might get a Kundalini yoga set that's good for opening your throat chakra. Every sort of set is good for something. They kind of give it something that it's going to help you with. And a lot of times you're encouraged to perform that same yoga set for 60 days or something like that. And in Kundalini yoga, you're working with your breath, as you are with all of these things, but you're doing sort of repetitive movements. So you might be moving your arms like this for 5 minutes straight, working with your breath. And that's the pose. Iyengar yoga is really focused on the alignment of each pose. So you're using a lot of props to help you to get into perfect alignment, regardless of whether your arms are long enough or legs are long enough to do the pose. So you're using props to help you do that. Anusara yoga is also focused on alignment, but doesn't use as many props and sort of focuses on the energetic components of the position. So you might be in a position, but you're focusing on rotating your hips inward while you're not actually moving them in that position. So it's a little different in that way. And then Hatha yoga is kind of like an umbrella term for yoga. So you might get kind of all of these. You usually won't see yin yoga or restorative yoga under that umbrella, but Hatha yoga is like a general flow yoga. So here are some tips to kind of introduce you and get you comfortable with participating in a yoga practice. The first and foremost thing is work with and listen to your own body. And modifications are allowed. So I always joke that yoga is very, yoga teachers are generally very easygoing. So if you go to a yoga class and you are just laying down the entire time and you fall asleep, the yoga teacher would probably be okay with that. So you can do whatever you want in a yoga class. It's completely up to you and what your body is okay with and not okay with. So just be comfortable with that first and foremost. Modifications are allowed. And if you don't know what the modifications might be, I would suggest that you talk to your teacher before a class. If it's virtual, just send them a message. If it's in person, go up to them before a class and say, hey, this is what I'm dealing with. One, can you give me some modifications? And two, just so you know, this is important to me. You know, like they will be able to help you as much as they can, and they might be more willing to call out the modification as they're going through class if they're aware of what's going on with you. The third thing that I'll say is do not quit. So if you go to one yoga class and it's really hard, that is just the initial phase, right? So I would recommend trying this for a few months just so you can kind of get in tune with how you're going to use a yoga practice in your life before you just say, this isn't for me. So give it a few shots, very many shots over the course of months, I guess, before you just give up on it, because it can be a really useful tool. And then focus on your breathing. If you notice that you're struggling in a posture or a position and you're not breathing, then you're not doing yoga. I mean, you are, but it's not the goal, right? So that's when I always tell people to kind of back off. You should always be able to breathe in any posture or position that you're in. The breath comes first, even if it feels too easy. And then also remember that every day is different. There are some times that I go to yoga and I can balance on one foot fine. And then the next day I might go to yoga and be like, what the heck? I was balancing just fine yesterday. What happened to me today? So it's kind of a good clue into what's going on with your body on a day-to-day basis. So just keeping that in mind, that it's not always going to be getting better, getting better, getting better. It's going to be some good days and then down, and then you'll eventually be getting better, but it's not going to be a straight up line. And it's that way with your posture and with your aerobic exercise as well. So just keep that in mind. Don't be too hard on yourself. So we're going to move on to a little bit of meditation and focusing on talking about meditation first, and then we're going to go into a practice of meditation. So how many of you feel like the picture on the left? Is your mind full of stuff, or are you mindful? Yeah. So mindfulness is kind of in alignment with being present, in that it's really just about having in your mind exactly what's in your environment. So forgetting about the past or the future, obviously that's important at times, but when you're really focusing on being present and mindful, trying to focus your attention on exactly what's in front of you. So this is what a lot of us look like, right? Especially in those initial meditations. And I can tell you that I've been meditating for years, not always on a regular basis, but there are days that this is exactly what I look like, where I'm just thinking about everything else but meditating. So thinking about why I need to be focusing right now, thinking about, oh my gosh, I need to get on to my next thing. Like, this is taking too long, opening my eyes, looking at the timer to see how much longer I have to meditate. Like, it just, there are ups and downs. But this is really what your meditation practice might look like. So initially you're focusing on your breath, and then you get lost. And then you kindly bring yourself back, and then you get lost in your thoughts again. So it's constantly just bringing yourself back to attention of your breath, or whatever it is that you're focusing on in your meditation. And what we're going to focus on today is sort of a mindful awareness meditation. So the sweet spot is what I like to call it, is just the space between the thoughts. So obviously we know that your mind is going to have thoughts, but the meditation is the piece between that when you bring your attention back. So we're going to meditate now. So I want you all to get kind of in a relatively comfortable position that you can be in for 5 minutes without fidgeting too much. And you could be laying down, any position is fine, but just get into that position. And close your eyes. So you're going to start by just paying attention to the sounds in the room. Notice what's around you. You might hear some cars driving by outside. Maybe you hear a buzzing of your refrigerator, or somebody walking in the other room. Maybe your faucet's dripping in the other room. Just notice those things. And then as you let them go, bring your attention inside to your breathing pattern. Start to notice without judgment, without trying to change, whether you're breathing through your nose or your mouth. Just being aware of it. And then notice that as you inhale, the air is a little bit cooler. And as you exhale, the air is a little bit warmer. Imagine the flow of that breath as you inhale goes through your nose or your mouth and down to your lungs, expanding your lungs, filling them up, and then exhaling every piece of air that you don't need. And then just following that a few times in and a few times out. As you do that, you notice the length of your inhalation and the length of your exhalation without changing it. Just notice. And then notice how as you inhale, your ribs rise and your belly rises. And then as you exhale, your ribs lower and your belly lowers. Maybe even noticing your heart moving in your chest. Noticing how as you inhale, you might feel a slight increase in your heart rate. And how you exhale, you might feel a slight decrease in your heart rate. You notice it slow down. And bringing your attention to your face, Noticing if there's any place that you can relax a little bit more. Maybe creating some space between your teeth. Notice if you're furrowing your eyebrows. You relax a little bit there. And then bringing your attention back to your breath. Again, noticing the length of your inhale and the length of your exhale. And then slowly opening your eyes. Bring your attention back to the room. And just notice how you feel. Do you feel any different than before you started the meditation? And if you do, if you feel positive in the way that you feel, realizing that you are the only person that brought you there, right? So you could do this again. You have the exact steps to bring you there. But it's all about just kind of calming your nervous system down. So to review everything that we went over, aerobic exercise, it's key. It's obviously where most of the research is in this area with regarding to movement. So what I tell people is just move some way every day. Choose your type of movement and do it every single day. Start really small. Work yourself up to at least 30 minutes 3 times a week, because that's what the research shows. And it doesn't matter whether that takes a week or whether it takes 2 years to get to that point. The goal is that you're on a path to getting there. And then with an end goal of getting to 150 minutes of moderate intensity per week. With posture, focus on your day-to-day posture by working on your pelvis position. Maybe look into setting up your workstation or computer environment to be better for your posture, to make it easier for you to have good posture, and then practice simple stretches and yoga exercises. And then with yoga and meditation, focus on being present. So maybe 5, even 1 minute per day. Focus on closing your eyes, paying attention to what's going on within your body, and then being kind to yourself when you lose your focus, because that's going to happen. We already know it happens to everybody. Or if you can't do a pose, also be kind to yourself. Back off a little, you know. And then, of course, with that, start small as well. And that's all I've got.
Whoops, I was talking with my microphone off. Thank you so much. I think we have, well, of course, we are all feeling a little more relaxed, as Jonathan said. We have one question here for you. Can you recommend any strengthening exercises for a beginner?
So I think that the strengthening exercises to begin with for a beginner are those scapular strengthening exercises that we talked about. So if that doesn't feel like strengthening to you, what you can do is use an exercise band and just like attach it to something and pull back while you're squeezing your shoulder blades together. Another exercise that I tend to give people for scapular strengthening is holding the band in their hands like this with their palms up, and then squeezing their shoulder blades together and pulling out, so they have some resistance with the band.
That's a great one. Great. Okay, thank you so much. Thanks for your